I'm now at Integrative Health Services here in Coldwater with Dr. Mark Lirot. Mark, welcome to the program. Today we're going to talk about lower back pain, and it's probably one of the most common pains that people have, isn't it?
Yes, it is. It is second for job loss and hours and time, only to headaches. So it's a major issue in the United States. $50 billion, that's with a B, is spent every year on low back pain and the treatment of it. 25% of the people that you and I know right now have had low back pain in the last 3 months. That's pretty impressive. 25%.
Well, and I know myself that I come in and get adjustments, and there's always it's something out because your lower back also it connects a lot of things. Going up and going down, like down the legs if you got problems with something pinched back there. So there's all different types of I don't want to say other issues that the lower back pain causes, but there are there?
Right, exactly. And one of the main causes of low back pain is disc problems. Again, most people have heard about herniated discs. They've heard about their discs being stretched and disc surgery. And so that's what we're going to talk about today is disc problems. There's a lot of ways to take care of these issues with the disc. One of the most common ways is surgery. And I just Googled on the internet what the average price of a disc surgery is in the Branch County area, and it's $13,000. So that's pretty significant when you start talking about people without insurance. Can they afford that? Do they have to live with the pain? And what we've come up with as chiropractic profession is a new technique in which we can actually help that disc to heal so that surgery doesn't have to be done.
So I guess really the summation of everything is there are options out there other than surgery to help with disc problems and lower back pain.
Exactly. Yep. And we can do that right here in the office. We have the technology to do that.
All right. Anything else, Mark, that we want to touch on?
No, let's take you back and set you up as far as on the table so we can show people how we do it and how simple it is. It's pain-free, and it's something that we do right here in the office. Just go ahead and lay on your stomach.
All right. And then what are we going to be doing? Obviously lower back.
Yeah, what we're going to do is, let's say that you had a disc problem right here in this part of the back. So we're going to concentrate on this level right here.
Okay.
When we start off, I just do a little bit of examination and see exactly what direction and stuff that I need to pull this. And put the traction on it to get that disc in. Actually, that should be a little sore right there.
That is sore. And that's sore. That's really sore.
That's really sore?
Yes, it is.
So we're going to go ahead and hook this up.
Now this is a special machine, right?
Yes, this is a
special table, I should say.
Table that will do this. There's different styles of these tables, but this is a special table that actually allows me to designate where I want to put the traction at on this disc. And so what now I can do is start to put just a little traction on that disc and pull it out. And then I can determine which direction I want to pull it in. Then we just lock the table in. And we turn the table on.
So now this is continually stretching?
Yeah, it's continually exercising and tractioning this disc at this level and taking that fluid and working it back into the disc area where it's supposed to be. And then it will start to take the pressure off that nerve.
Now how long would something like this take, Mark?
Normally, our first session, we work about 10 to 15 minutes doing this. And then we continue to do follow-up sessions until the disc is healed and back in to the proper positioning that it should be.
All right, talking to Dr. Mark Lirot at Integrative Health Services, talking about lower back pain. And again, there are alternative ways of alleviating that pain, and one of the ways is through chiropractic. I'm Tim Hart, and you're watching Our Community.